Hello, everyone, and welcome to County Health Rankings and Roadmaps 101, using data, evidence, guidance, and stories to build healthy communities. After today's webinar, we hope that you will have learned more about who we are, what we do, and why we do it. But more importantly, we hope you feel prepared to use data, evidence, guidance, and stories to support and strengthen your own work. My name is Justin Rivas, and I'm a network strategist with County Health Rankings and Roadmaps, and I am coming to you from warm and sunny Wisconsin, which is not a phrase I get to say a lot. The County Health Rankings and Roadmaps program is based here at the University of Wisconsin Population Health Institute, and it is a collaboration with the Robert Wood Johnson Foundation. We would also like to acknowledge that this program is the result of the contributions of many colleagues and partners in Wisconsin and across the nation. Thanks to their support, we're able to bring you this webinar today. So fortunately, I am joined by a small team of wonderful colleagues. I'm going to welcome them individually, and they're all going to kind of come on the screen and say hi as well. So first, let me welcome Annie Rubel, who's a population health analyst.
Justin, hi everyone.
Hey Annie, and next Jesse Soltz, who's an evidence analyst with What Works for Health.
Hello everyone, thanks for joining us.
Hey Jesse, and lastly Joe Hinton, an action learning coach with the Community Transformation Team.
Hello everybody, good to spend time with you today.
Great. Hey there, Joe. So our colleague Joe Hinton is also helping us out by watching the questions box, and our colleague Erica, who's a familiar voice on our webinars, is watching the chat box today as well, so you might hear from her.
Yeah, and thanks, Justin. Erica and I are going to take just a second to tell people how they can interact a little bit with us today. For anyone who wants to ask a question of any of the team, please use the Q&A icon that you see at the bottom or at the top of your Zoom interface. If you want to respond to a question posed by one of the speakers or provide a resource or thought of your own, you can use the chat icon. Erica, can you tell us a little bit about how everyone on the webinar can make sure their chats are seen by everybody?
Sure, Joe. If you all will just click on the chat icon, a separate Zoom group chat window will pop up. And if you want to make sure that all of the presenters and webinar attendees can see your message, use the drop-down menu beside the To field and switch the option to all panelists and attendees. This is the best way to ensure that everyone sees your message. And then, like Joe said, populate those questions in the Q&A box.
Great. Thank you both, Erica and Joe. And we really hope to hear a lot of your questions and chats today. We want this to be as kind of interactive as possible. So we look forward to that. All right, so let's start with the why here. Why does County Health Rankings and Roadmaps exist? And why do we produce the tools and resources that we do to support communities? County Health Rankings and Roadmaps has really two primary overarching goals. The first is to improve health outcomes for all, and this means supporting communities to improve how long and how well people live. And our second goal is to close the health gaps between those with the most and least opportunities for good health. We believe that everyone should have a fair opportunity to be as healthy as possible, regardless of where we live or the circumstances we are born into, knowing that the choices we make depend on the opportunities we have in front of us. Imagine a place where everyone has a fair and just chance to lead the healthiest life possible. A place with high quality schools, good paying jobs, access to healthy foods, quality healthcare, and affordable housing in safe environments. Imagine a place where differences in race, culture, and perspectives are not only tolerated, but are celebrated as fundamental to health and well-being. Imagine that this is how we all experience our own communities, regardless of where we live and these circumstances we're born into, or how we look. Now think about your own community. Perhaps think about who is not thriving in this way, who doesn't have the same opportunities for good health, and what barriers have been put in place over the years to cause this, and what will it take, more importantly, to remove them and change the opportunities in your own community. So what opportunities do you see in your community for closing gaps in health, or this concept of health equity we're talking about? You can chat those in right now and just give us some ideas of what you're seeing in your community, and make sure you're chatting to all attendees, and that way everyone can see your responses. And we'll check in with Erica in a little bit and she'll share back some of your responses and thoughts. So this graphic here helps us understand why equality is just the starting point to closing gaps. We need more than the same resources or opportunities available to everyone. For example, in this graphic, the same adult bike would not allow everyone to ride safely to get to where they want to go, and some could not even ride it at all. But think instead about an equity approach where everyone, again, has a bicycle, but the type is based on what they need for their own unique and individual circumstances. Inequities result when there's a lack of opportunity and resources to thrive. And in this example, this would be a bike that meets everyone's differing needs. It's important to remember that these conditions and obstacles are both unfair, avoidable, and they're modifiable, right? We can change them. So we talked about the why. Now we'll look at the what and the how. As I mentioned, one of our goals is to improve health outcomes. Let's look more closely at this. This image you see here is our rankings model, which many of you may be familiar with and some of you not. And this helps us understand what drives health in a community. One of our goals we have had with this image is to help change the conversation about health and what influences health. What this image shows us is that health is more than what happens at the doctor's office. A wide range of factors influence how long and how well we live. It includes things we often think about when we hear the word health, for example, healthcare and how well we eat and how much we move or get exercise. But we also know it's things like education and income, the quality of our housing or accessibility of our housing, and the safety of our neighborhoods. With an understanding of what influences health in a community, how can you plan to take action to improve your community's health? The Take Action cycle is our way of thinking about how to create a healthy community. We believe that community transformation starts with assessing needs and resources, so that's in the upper right-hand part of the graphic, and moves through the cycle to evaluation. Communicate and work together are around the graphic and around this cycle because these are the activities that are really essential throughout the entire process. At the center are the community members and the residents and people that are really doing the work. We know that when people work together with a shared vision and commitment to improve health, it can really yield the best results. And this means centering with those community members and involving and engaging all the stakeholders you see around them. Putting these ideas into practice takes a comprehensive approach, and we've developed various tools and resources to help you along the way. We'll take a look at those tools and resources in just a bit with all of our featured guests here, but I want to check in with Erica quickly to see if there's anything exciting popping into the chat box we can share out.
Thanks, Justin. Yeah, it's been quite active, and I want to encourage people to continue to share some of those opportunities you're seeing. Sumaya was saying where she is, they're implementing community listening sessions, and Janet is talking about equipping physicians with tools to address the social determinants of health in clinical practice. Karen was talking about working across sectors to support current residents in developing communities. We see lots of folks talking about specific types of health conditions like diabetes and ways that communities can come together to support ways that people can make their lives healthier, such as grocery stores and expanding healthy food opportunities, bicycling. So these are all good ideas. Keep them coming in.
That's great, Erica. Thanks. It sounds like a lot of conversations and really defining health in very broad terms, which is great. So I want to move on to how we support communities, and we do that to bring people together to look at the many factors that influence health, select strategies that can improve health for all and close gaps, and make changes that have a lasting impact. So we do this in kind of 4 different ways, as you see here, by providing data, evidence, and guidance for communities. We also work to gather and share stories of communities from around the country that are at different points on this journey, and to let them serve as examples to each other and inspire other communities around the country on ways to work with partners to think about improving health and closing gaps. We're also going to dig deeper into each of these areas in just a bit, but first we'd like to get a quick sense of how familiar everyone is with these different types of resources with a quick poll. So we're going to launch a poll and looking for a little engagement here. It should be coming soon, and I'll let Joe walk us through this poll here if you'd like.
Sure, Justin, thanks. So the poll question that you see on the screen is to just give us an idea of the places on the County Health Rankings website that you have visited. So I'm already seeing a lot of people have seen their data and county snapshots and their health measure reports. That's one of the options. We do have the evidence section of the website, the what works for health strategies and our evidence and informed policies and practices. Our guidance section, which includes our action center and the partner center. the stories section where you can read about RWJF prize communities, and then maybe something else. So can't wait to hear maybe in the chat what some of those something else options are. So just a few more seconds on that poll and we'll see what our responses are. We're doing great. Over 60% of you have participated. That's terrific. All right, about 5 more seconds and I'll close out the poll. All right, thank you for participating in that. As you can see, no surprise, a big draw to our website is that County Health Snapshot and the health measures and reports, and 97% of you have been to that portion of our website. So we're definitely going to talk about some of those other places, but we're glad that that's what has brought people in, and we'll continue to introduce you to more spots on our website.
Speaking of which, thanks for that segue, Joe. And we'll get to really moving from all that familiarity with data to action in just a bit here. So I want to show you quickly where you'll find these different tools and resources. This is our new landing page at countyhealthrankings.org. Annie will go briefly to the website when she discusses our data resources, but I want to show you some basics to point you in the right direction first. So take a look at the orange bar at the top of the screen. You'll find our data resources primarily under the Explore Health Rankings tab, so that first tab. The evidence and guidance tools and resources that Jesse and Joe will discuss in a bit, What Works for Health, the Action Center, our Partner Center, and are under the Take Action to Improve Health tab, so that second tab. You'll find some stories as well as links to upcoming and past webinars and other learning opportunities in the Learn from Others tab. And if you need some additional background in understanding or thinking about health and what influences health, you'll find that under the What is Health tab. And lastly, if you're looking for downloadable reports, such as the Key Findings Report that came out this March of 2019, your individual state reports, or some specific What Works for Health issue reports that Jesse will cover, those are listed in the Reports tab. All right, so we'll start with data. In our work with communities, we get a lot of questions about data. And Annie, let's get started. Why is data such an important resource for communities?
Well, Justin, data is a resource that can be used all throughout formal and informal community health improvement processes. First, it can be used to assess the health of a community. Communities across the country are incorporating county health rankings data into community health needs assessments, as well as other health improvement strategies. Data can also be a tool for engaging non-traditional community partners and community members in the health improvement process. It can help identify root causes of health issues, support decision-making and policy change, and track progress. As communities take action, they have used data from the rankings and other sources to understand whether policies, programs, or plans are on track to improve health.
So I've certainly seen communities using data for all these reasons, Annie. How do the county health rankings help communities do this specifically?
That's a good question, Justin. So I think it's a good time for me to share my screen and show you some of the resources that we offer. So give me just a second to share that screen.
Great. So Annie's going to use her live web tour skills and she'll give us a little more background. Thanks, Annie.
There we go. We got the website up.
I'm seeing it.
Perfect. So this is the county health rankings page, as Justin showed you, and we live in the Explore Health Rankings data. And on this page, you'll have access to all the state and county level data here, tutorials and information about using the data, as well as information about our background and methods. And you'll also be able to find the state and key findings reports from this year on the Explore Health Rankings page. So Justin, what state should we look at first today?
Let's stick with my home state of Wisconsin.
Okay, so just type in Wisconsin in the search bar and it'll bring up your state landing page here. So you'll always see the two maps, health outcomes and health factors, which show the distribution of more and less healthy counties in your state. You'll also see the state reports as well as state data and resources, additional data, as well as communities from your state, community stories from your state, as well as the contact information who can help you find more or navigate these resources and might be helpful to you.
Great. What are the state data resources and community health improvement resources I see?
Yeah, so we know that rankings data is just a starting point for understanding health in your community. So in order to help people get the information you need, our team finds state-specific data resources and community resources that can help you dig deeper into those different measures and metrics. So just an example there for Wisconsin about some state-specific resources that we provide in addition to the rankings. So now let's take a quick look at a snapshot What county should we look at, Justin?
I'm going to be egocentric still, and let's go with Milwaukee, my home county.
Milwaukee, okay, there we go. There's Milwaukee, so that'll bring up your snapshot. And when I'm first looking at a snapshot, I try to get a picture, or overall picture of the county's health. And so our health outcome and health factor ranks help us do that. And you can see that Milwaukee ranks near the bottom at 71 of 72 of ranked counties in Wisconsin. And within that, you can then look at ranks among the health factor areas. So you can see different health behaviors, clinical care, social and economic factors, and the physical environment, which make up that rank. You can see Milwaukee is doing better in clinical care, perhaps due to some of these metrics, dentists and mental health provider ratios, and it might have some work to do here in social and economic factors, where, for instance, it has a pretty high rate of children in poverty. But I'm jumping into the data, so let me take a step back for you and just orient you to the snapshot itself. So the snapshot will always have all the ranked measures here on the left, and if you hover over them, you can see a brief description there. And I want to let you know there's additional data underneath these plus signs, so feel free to open those up and get other county metrics. The first column is always going to have your county data for that measure. And if it's highlighted in blue and underlined, it'll have race data available. So this is only available, or it's there when data is available by different races, so feel free to click on that. The second column is trends, and those icons are green, red, and yellow, depending on if it's improving, worsening, or staying the same. There's an error margin, which is the 95% confidence interval around your county's estimate, and then the top US performers in Wisconsin, or your state value. So to give you a little context and go back to your original question, after I look at those ranks, I like to look at the trend graphs for premature death to see what's going on in your county. So let's open that up, and you can open all of these up and use them as you need. And so you can see the data for your county, the US, and your state over time, and all the corresponding data points are at the bottom of those graphs. And you can see over time it's improving, which is why the icon was green, but this increase in the last couple of years might be an area of concern for Milwaukee.
All right, so there's a lot of measures here. It looks like a lot of really useful information. How are folks supposed to know kind of which measures to focus on or where to get started?
Yeah, that's a really good question, Justin. And helping a community define their focus areas, definitely a multi-step process that has to look at both what the problems are and what solutions might be available. And so we provide some tools that can give you a head start. If you click on the areas to explore and areas of strength at the top here, that'll highlight county metrics, which are better or worse than the state or national mean. So they can kind of give you an idea of how your county is falling in terms of better or worse than what you might expect. So for example, an area to explore here is teen births. That value is 34 per 1,000. And that's definitely higher than the Wisconsin value there. So that's highlighted as an area to explore. So these comparisons aren't intended to replace a true priority setting process, but they can give you a quick peek into strong and weak areas in your county. The other thing you can do is always compare to the state value or these top US performers, and these are the top 10% of counties for that measure. So I like to think of them as what you would need to do to get an A on that measure, so it can be a good priority setting process. The other thing I want to highlight is the Compare Counties tab up here at the top, where you can actually compare your county snapshot to any other county in the US. And within that, our partners at CDC and the Community Health Status Indicators Group have provided a list of peer counties to every county in the US. So they're counties that are similar to your county based on demographic data and social and economic data, which might help you with that priority setting goal. So the last thing I want to highlight here in the snapshot is that you can go into any measure and get a lot more information. So the measure pages are always going to bring you to a map of your state where lighter colored counties are better performing for that measure. But there's also a data tab here. So this is the data table for your state for that measure. And you can sort your counties in that state by the metric or alphabetically. The trend graphs are also available here, as well as the error margins. And again, if that data is available by race, that data is there. And again, if it's missing here, that means that we didn't have reliable data. So it's just a missing value if it's a blank. The description tab is really useful, and we've done some upgrading to this in the last year. So I encourage you to check it out if you haven't been there lately. We always include a reason for ranking or a reason for inclusion if it's an additional measure. And this can be really helpful to think about how it's relating to health, or if you're going to communicate on this measure, it's useful to check out. Then measure methods. So these are key methods that you might want to be aware of if you're using the metric. But I really want to highlight these last two areas, track progress and digging deeper. So track progress talks about if you can use this measure to track an intervention in your community across time. And if you can, what things might you want to be aware of if you're using this specific measure. And then digging deeper talks about if this data, this particular measure or set of measures is available by different demographics within your county. So is it available by age, gender, race, etc. And if it is, we give you a little bit of guidance on how to find that. So that can be really useful. There's also the data source tab if you want to learn more about where the data comes from. And then in the health factors area, there'll be a policies and programs tab, which my colleague Jesse will talk about in a little bit. So that's the crux of the rankings website. But there's always plenty more to explore.
Yeah, Annie, I know you're going through a lot and somewhat quickly. I just want to remind folks that we will have all these slides provided and available to you, and also the intent of the website is to be as user-friendly as possible. Annie's already covered a lot of stuff, and I just want to ask if she could highlight just any other ways to explore the data a little further as well.
Yeah, I'll highlight one more thing that we're really proud of this year. So back in the Explore Health rankings, Justin showed the model when he kicked off this webinar, but we actually now have an interactive model. And you can actually click on all the boxes in the model, see how they relate to each other, relate to health outcomes overall, learn more about it. If there's more information you need, it's probably there. And then it lists all the measures, ranked and unranked, that we have in that health factor area or health outcome area. So for instance, if you read the state and national key findings reports this year, we highlighted housing. So if you want more information about home ownership or severe housing cost burden, two of the measures we highlighted, this would be a good place to look and start to learn about those measures in our metrics. So I think that's it. And I'll go back to the slideshow now, Justin, and just do a few key takeaways from the data section for you guys.
That'd be great, Annie. Yeah, I think that interactive model feature is really helpful for people to kind of see where they're working within the model. So I'll pull everyone back to the slides here. And yeah, Annie, take us home here.
Perfect. Yeah, so I just want to highlight that rankings are definitely a starting point, and they're a great starting point to draw attention to the problems that matter in your community. But we encourage people not to stop at the rankings, turn into the data, and then most importantly, use the data to drive action. So with that, I'll turn the presentation back to Justin. And we'll talk about some evidence.
Great. Thanks again, Annie, and thanks for all your expertise. I'm not going to give your personal email or phone away because I know people will be calling you off the hook because you're such a good expert here, but we really want to let you know that we do provide support with using all of these resources, and Joe will share some more about that in a bit. So once you've used data and to think about the challenges and strengths, then it's time to figure out really what to focus on and how to improve it. And what strategies should you think about implementing really is the most important part. So one factor in deciding is the evidence, or how effective a strategy has been at changing outcomes. So we're going to turn to Jesse now, one of our evidence analysts, to walk us through our evidence resource, What Works for Health. But before we jump into what works for health, let's start with this basic concept again, and an important question. What exactly is evidence, Jesse?
Unmuted. I apologize. I forgot to unmute. Hopefully everybody can hear me now.
Loud and clear.
Excellent. Thank you for confirming. So we hear this word evidence a lot. Evidence-informed, evidence-based, and terms like proven, model, or promising. This word has different meanings to different people and varied organizations who work in this space. Before we dive into what evidence means for us, I would like to take a minute to ask you to think about what evidence means to you. So we're going to do this with a poll. This poll will ask about what is important to you when you are making decisions about your personal health, but it can also apply to community health improvement. So we're going to pop up some options on the screen in a Zoom poll now. Please select as many answers as you would like. There are no wrong answers. So in looking at this, please consider how you currently select strategies. Do you use your intuition about what can be effective? Are you making decisions based on what you've heard others are implementing within your field? Do you consider past experience with similar situations and strategies you might have used? Do you examine the results of controlled experimental studies that show a method is helpful? Do you factor in what you know by critically reading the literature in the field, or do you consider something else? So we're going to give that another couple of seconds.
It's looking kind of like a mixed bag here to me, huh?
Yeah, I can't see the results. So Justin, do you want to
Oh,
tell
sure.
us what our
Yeah.
answers coalesced
I
around?
was hoping you could just pull it out of thin air. Yeah,
Well, you never know.
we'll stop and we should be able to share the results now, but it looks like a majority are going with past experience with similar situations and other strategies they've used in the past. And then half the folks also thought that results of controlled experimental studies demonstrating a method is helpful was high up there too, and critically reading the literature. So a couple areas really rung true, and they're again not mutually exclusive. So I'll let you carry on, Jesse.
Excellent. Thank you for reading that off.
Mhm.
When we in What Works for Health think of evidence, we focus on options 4 and 5, the results of controlled experimental studies and critically reading the literature. They are important components, but as many of you indicated, they are not the only thing that should be considered.
All right, so I've mentioned What Works for Health a few times already, and what exactly is What Works for Health?
At its core, What Works for Health is a tool to help communities make decisions about the strategies they can use to address local health priorities, and do so without reinventing the wheel each time. It really makes harnessing evidence easier for communities. So you're able to explore strategies by topic or using a keyword search from this page on our website.
Great, thanks, Jesse. And folks will notice that these strategies by topic are exactly aligned with the model we explored earlier. So as a program, we believe evidence really matters. So tell us more about that and the kind of why behind using evidence-based strategies.
Evidence can help you to drive smart investments and stretch the impact of scarce dollars. It can also help inform decisions about when to adopt tried and true options and when to be more innovative. And it can also help to inform innovation. Knowing what has been shown to work and what hasn't can help to ensure that innovative solutions are effective.
Great. And Jesse, what does What Works for Health have for communities looking for evidence to inform their work? Meaning, what are some maybe resources?
Of course, What Works for Health is much more than a database of strategies. It provides the available evidence and examples of where strategies have been implemented. By strategies, I mean policies, programs, systems, or environmental change. What Works for Health is a living resource of over 400 evidence-informed strategies. We have done the homework and literature reviews, and you can explore to choose which strategy fits for your community.
And specifically, what does each strategy include? Just kind of what's laid out within each of those strategies when someone clicks on one of them, for example.
So for each strategy, we include an evidence rating, which conveys the likelihood a strategy will work based on best available evidence. It is core to what we do and how this resource can be useful for you. It indicates which strategies have been shown to work, those that might work, and those that have been shown not to work or to cause harm. We also include a short literature summary that highlights who a strategy can benefit, what it can do, and, as we're able to access it, information about costs. We also include disparity ratings to help communities use an equity lens as they explore strategies, and we include implementation resources to move from idea to action.
Great, Jesse. It's amazing that you guys have kind of looked over 400 strategies at this point, but I personally don't have time to look through 400 strategies. So what if people are looking for strategies about a certain topic? How can they narrow this a little?
Well, we don't expect everybody to be able to go through all 400 strategies. It is quite a bit of looking. I would suggest using the keyword search or clicking on the individual topics from our landing page. We also have a few reports that create smaller sets of strategies to start from. In 2016, we released a report on strategies specific to rural areas. And in 2018, we put together a report on strategies that can improve social and economic opportunities, specifically related to education, income and employment, and family and social support. If you start with these reports, you'll then also want to return to our website to learn more and make sure you have the most up-to-date information, just noting the dates that the reports were produced.
Yeah, I think one of the best features is you guys are always updating this stuff. It's a living resource that's constantly moving in real time. So can you maybe just take us through what a strategy looks like?
Of course. So this is a shortened version of our mixed-use development strategy. We're not going to be able to walk through all of the details today. This is just a quick glimpse of what all the elements we've outlined look like when they come together to form a strategy. On each strategy's landing page, we include the title on the left and the temperature gauge, which shows the evidence rating, and the strategy's description at the top. Moving down, you'll see the expected beneficial outcomes, and then you've got a snippet of our evidence section, which is our literature summary. Moving to the panel on the right, you'll see our assessment of the likely impact on disparities, which communities indicate they especially appreciate seeing, and implementation examples and implementation resources, which we've heard undergrad and graduate students use in program planning classes. This specific strategy also has a community in action story featured on the bottom left side, which you can check out for even more information about how a community made use of this strategy. So this is still quite abridged, so please see our website for more detail.
Thanks, Jesse. I'm really feeling the theme this afternoon. There's just so much great quality content that's available here, and it's a lot of information. How do you think communities can really make the most of it?
So we like to suggest that communities make use of an approach we think of as evidence plus. This approach connects the evidence you find in each strategy with your local culture and context. As you explore what works for health and read specific strategies, you'll find content to support this approach.
And how would you do that?
You start by asking questions like, does the strategy work? Will it work here? Then you're going to look into the details. You'll consider the evidence ratings, which show the likelihood a strategy will work based on the best available evidence. There's also a field called expected beneficial outcomes that will show you what it's rated for. You then want to confirm that these outcomes matter to you. Reading the evidence of effectiveness summary can help you know if a strategy is likely to work locally. Do you see populations like yours? Communities like yours? Then you're going to want to look to the disparity ratings, which indicate the likely effects on disparities or gaps in expected outcomes. And then finally, you'll look to our implementation examples, which include toolkits, model policy language, and illustrations of how communities have put a strategy into action.
We've talked a lot about stories being one of our resources and understanding what other communities are doing. Annie shared a few in her data overview, and now let's look at how communities can use what works for health in a couple of ways. So here are two quick examples I like to share about that come from groups that have been working with our community coaches or action learning coaches. The first example is in Sitka, Alaska, and this was a team I actually coached, so I know this personally, but their team used what works for health at their annual health summit, and it helped them to inform goal selection and through the consensus process of their multi-sector coalition. Because it's very accessible as a resource and easy to use, it can be great to use with larger community groups, and it can help to inform the group discussion around strategy selection as it's relevant to their own community. Another example comes from the Health Foundation of LaPorte, Indiana. They used it in their grant making process so that local organizations could search for programs and policies that are examples that really had a strong evidence base to inform the pursuit of their grant funding. We know many funders want communities to use evidence to inform their work, and this resource can take a lot of the legwork out of doing that process, and it can help local organizations that may be resource kind of strapped to get a head start on doing this work. So I'll let Jesse, yeah, go ahead.
Thank you. Sorry, tried to take over a little too soon. But in summary, here are some of the key takeaways for What Works for Health. Evidence is a truly important part of decision making. What Works for Health provides information about what works, what might work, and what does not work. So you should try and connect the evidence available with your local culture and context to ensure you can find a strategy that will work for you and your community.
Great, Jesse. Thanks so much for sharing, and I really hope listeners can take full advantage of what Works for Health. I think it's one of the best resources we have. So we've talked about data and understanding community needs and assets, and we've talked about using evidence to understand what communities can do to change health outcomes. So where does guidance fit into this picture? We'll bring Joe into the conversation now.
Yeah, thanks, Justin. I'm glad to share a little bit about our guidance. So we know that the work of transforming communities may feel a little intimidating. We believe that by supporting communities with guidance about how to take action and who to work with, we can accelerate their progress toward improved health outcomes and health equity. The Action Center is one of those places where we offer guidance, and you can find this under the Take Action to Improve Health section of our website. It provides step-by-step guidance and tools to help you move with data to action. The Action Center answers the question, how can we take action? Each action step is broken down into key activities with guidance and suggested tools to support your work.
Joe, how would you recommend folks can really use the most of this resource, the Action Center?
Well, Justin, when you get to the Action Center, you'll probably notice that there's some numbered steps there. Take a look at the steps to move your community forward. Where do you see your efforts? For example, are you assessing your needs and resources or trying to choose effective policies or programs? Depending on where you or your coalition is in its efforts, you can choose whichever guides are most useful. You can also think about where you're feeling a little stuck. Maybe you're having trouble moving from the assessing and planning to actually implementing policy changes or programs you've selected. Then act on what's important can help. Maybe you struggle to keep your partners engaged or to recruit diverse stakeholders to your efforts. Our Work Together guide can help. Click into the guide that seems most useful, review the related key activities, and choose the one that resonates with you. I'd also like to encourage all of you to think of the Action Center as a just-in-time resource. You can revisit it, find the right resources when you need them, and then revisit it as frequently as you need. I suggest setting the Action Center as a favorite in your browser. I know it's a favorite in mine, so you can come back often.
That's great, Joe, and I like the advice about thinking about where you're stuck. I think that's really helpful. I want to share a few examples from one of the teams that we coach that use tools and guidance from the Assess Needs and Resources Guide. In Oscoda County, Michigan, the coalition was well aware of the challenges in their community, but what they needed to understand were the assets. So working with their coach, they turned to the asset-based community development tool, which you can find in the Action Center, and this helped them frame their process for understanding individual and community assets that already existed in their communities and that they could build on. This process helped them build momentum for community events and open doors for collaboration and leverage further assets. So Joe, let's talk a bit about the Partner Center next. What kind of guidance can people find there?
Yeah, Justin, the Partner Center reminds us that we all have a role to play in creating healthier communities. By working together, we can achieve more than if we try to work alone. The Partner Center, which you also find under the Take Action to Improve Health section of our website, is all about joining with others to make lasting change in your community. It answers the question, who should we work with? Think about the people in your community who make positive changes happen. We can call them leaders, change makers, stakeholders, whatever you call them, these are the people you want to partner with. But how do you reach them? You start by doing some research to find out what their goals are and how they might align with yours. You think about what's in it for them, and you find a way to get connected to begin cultivating relationships. The Partner Center is a great place to help you get started. It provides guidance on why different sectors might care about creating healthy communities, what those different sectors can do and contribute to creating healthy communities, and how you can engage with them.
I think this is really helpful stuff, and I'm going to prompt you with the same question. How do you think viewers today can really get the most out of the Partner Center?
Well, I like to remind myself that many of us have different roles in our communities. We might work in healthcare, but serve on a government board. We might work for a not-for-profit that also provides funding to the community. So I always like to start with the roles you play in your community. If you don't see yourself in any of those boxes there, I would recommend thinking of yourself as a community member and starting there. So to actually get a little bit of an idea of how people are viewing themselves and the work that they're doing in their community, we're going to launch a poll once again. So one more time to participate. And that poll is going to ask us, which sectors are we most interested in partnering with? So you can see all of our opportunities and sectors up there on the screen right now. We have community members, community development, government, business, educators, not-for-profits, public health, healthcare, and funders. And I still like the something else or someone else option as well. So if you have other ideas of who you'd like to be partnering with, chat those in and maybe Erica can tell me about them.
And while that's rolling in, Joe, I think this is a really good thing to ponder and think about, because as we're, in this public health 3.0 space of really understanding that we need this kind of collective action and harnessing these different stakeholders to work on issues, this is a really important part of the work. So I think it's great that people are diving in with the responses here too.
Yeah, and we're seeing a widespread across the different sectors, Justin. So it's really great to see people already thinking about having these cross-sector partnerships. So I'm going to close the poll here in just a second and show you just how diverse our thinking is on partnerships. And you can see, while public health is the sector we're most interested in partnering with by just a little bit, man, every sector is well represented. So we're all recognizing that we have opportunities to partner across our communities.
And Romney just chatted in about the faith community and educators.
I agree, Erica. I always think about the importance of those community-based organizations, our faith community, getting the educators and the students involved. I think that's terrific insight.
And I think that the faith community is a really good example of when you think about how people are wearing different hats in community and what roles they can play and how to continue to build those connections, right?
I agree completely.
All right.
Yeah, go ahead, Justin.
We're moving on just a bit here. So I understand that County Health Rankings and Roadmaps website has a new group of features that I know you're a specialist in, Joe. So I wanted you to share how coalitions and groups can use these.
Yeah, thanks, Justin. We just get too excited about the new things we have. I wanted to jump right in. So as you can see on the screen right now, I want to tell you a little bit about the first of our 3 action learning guides. They are self-paced and interactive guides that blend guidance tools and activities for hands-on practice and reflection. They're designed to support you and your partners as you deepen your learning on select topics. You can once again find them on the Take Action to Improve Health page of the County Health Rankings website. And I'm really excited about these because they're just a really great and complete resource. They have companion worksheets that allow individuals to track their own progress through a topic, or it allows members of a group to collaboratively discuss that topic. Our first 3 guides that we've posted are focused on introducing guide users to equity, on the importance of partnering with residents, and how to get started with policy change as a pathway towards improving community health.
That's great, Joe. So as people know, the rankings are built on competition. And as we heard, the data team has over 30 measures in their snapshots, and the evidence team has over 400 strategies. Are we going to get more than 3 action learning guides, Joe?
Well, now that it's about competition, of course, there's going to be more guides. I encourage everyone to dive into these first 3 guides, but check back throughout the year and in future years as new guides will be launched periodically.
That sounds awesome. Thanks, Joe. What can the audience do if they want to connect with someone from our team about anything that we've really discussed all day today?
Well, I'm going to encourage them to reach out to one of our action learning coaches. Our action learning coaches, that group right there, are a team that helps strengthen communities through online guidance and virtual learning opportunities. If you need a thought partner to help you get unstuck or to think about how to use any of the resources we've talked about today, please reach out to us via the Contact Us form. You're going to find the Contact Us button on the bottom of any page of our website. And once we hear from you, one of the coaches will be in touch with you to learn more about your community and your specific needs. So in summary, the Action Center is the part of our website that answers the question, how can we take action? The Partner Center answers the question, who should we work with? Those new action learning guides allow for self-paced exploration of the topics. And our coaches are available to connect with you and to talk about any of the resources that you've seen or heard about today.
Great, Joe. Thanks for that wrap up and all that information. We're going to get to questions in a bit, but I just want to share just a bit about the stories part, because stories are really important. Sharing the stories of others ignites possibilities and really inspires action. Our Learn from Others section provides multiple ways to find out more about what other communities are doing. Right? You can find out about our upcoming webinars or watch archived videos highlighting community stories. You can read about the journeys communities have taken in our community highlights section, or you can learn more about the Robert Wood Johnson Foundation Culture of Health Prize and various winners and the stories of their wonderful communities. And this is an example here, Columbia Gorge region, which was a 2016 winner. So I'm going to share a little more about the prize here. The Robert Wood Johnson Foundation Culture of Health Prize honors and elevates U.S. communities that are making great strides in their journey towards health. Prize-winning communities have placed a priority on health and are creating powerful partnerships and deep commitments that will enable everyone, especially those facing the greatest challenges, with the opportunity to live well. This is another picture of a community, San Pablo, California, which was a 2017 winner. So the criteria of how these prize communities are assessed is really important, right? So the 6 prize principles displayed on this slide drive the selection of how they're selected. We're looking for communities who are able to bring these criteria to life in their communities. So just a heads up, the next call for applications for the 2019 Culture of Health Prize will be released this summer in 2019. You can find the prize call for applications and additional information about the prize program and past prize winners. That's a lot of P's. At the Robert Wood Johnson Foundation, rwjf.org/prize. So I wanted to leave some time here so we can really get into some robust questions, and I'll let Joe kind of lead off the Q&A here and bring in some attendees' voices.
Yeah, Justin, thanks for that. And we had a lot of great questions. We have a couple of questions in the Q&A box that we're going to try to get to here in just a second. But we also had some wonderful overachievers who sent us questions before the webinar, and we wanted to make sure we could lift up a few of those. So I might ask Annie to join me for just a second. We had a question from Charlotte in Danville, Virginia, before we started today about what kind of new data measures are we working with in 2019?
Oh, that's a great question, Joe. Yeah, so we update our data every year, so there's always new measures coming. So this year we had a couple new measures, especially in our quality of care area, including flu vaccinations and some that changed slightly. So I encourage them to look at a previous webinar we did called Making the Most of the 2019 Rankings, where all those are listed. And then we also added the additional measures this year that I kind of touched on, of severe housing cost burden and home ownership, as well as a measure of life expectancy at the county level. So those are the new ones, and some had a couple little changes that are also included in that webinar.
Yeah, Annie, thanks for sharing that. And the webinar that Annie mentioned from March is a terrific resource, and we had a lot of questions. The Q&A really lit up during Annie's presentation on learning more about data. And so we're going to encourage you to go see that webinar. We're going to include a link to it in the resource guide that we're putting together for today's webinar, so you'll have a chance to go back and capture that. I want to grab a question for Jesse as well. Jesse, there was a question from Kristen from Dallas, Texas, about how do we best put or most effectively put evidence-based strategies into action?
Of course, this is an excellent question. We like to recommend an approach that we call Evidence Plus. We know evidence is important, but when you're moving towards action, it's equally as important to think carefully about your local context, capacity, and culture. For example, how might your chosen strategy affect disparities? What works for health disparities rating can help you use an equity lens. Or do you have all of the stakeholders present that you would actually need to get going on this? The decision makers that we include listed on What Works for Health in every strategy can be a great way to identify partners to connect with if you don't already have them at the table. Or you may also want to consider if your selected strategy can be adapted to address local needs. If you think adaptation is necessary, then a robust evaluation is especially important. So, Joe, would you like to add anything to that from a coaching perspective?
Yeah, I think that I always find that communities are really interested in seeing the implementation examples and really thinking through communities that look like them or feel like them so that they can have maybe a thought partner from hundreds or thousands of miles away that has gone through a similar situation as they're trying to take on.
Excellent. And those are always fun to get to do the research on. I know I enjoy that. So communities keep things coming so we can make use of it.
That's right. I'm going to actually grab a question that came in that I thought that I might be able to address. So we had a question from Nicolette from Kansas City, Missouri. And she asked how public health departments can leverage county health rankings to improve community health. And that leverage word is one of my favorites. And I'm glad to know that Nicolette and a lot of others might be thinking about the rankings release or our materials as ways to continue or improve or continue or restart conversations about improving health in the community. So as I kind of think about the ways that you can do that, I think that if we're taking this from the data perspective, the assess needs and resources step in the Action Center, which we mentioned is under the Take Action to Improve Health page of our website, is a great place to start to think about ways that we can use data to start conversations. I'm really excited about the action learning guides. I know a lot of the coaches on our team are excited about those. When we think about bringing new voices and new partnerships into the conversation, we have a new action learning guide that is thinking about engaging with residents, partnering with residents guide. So I think we have a lot of resources that can jumpstart conversations, continue conversations, and we always like to say that we're there as resources to be thought partners in this process.
Joe, I think you were saying voices there, and I was thinking about the importance of communications in this work too. And I can pop on screen. So maybe I can ask one more question here that I think is to you, Joe, that I think is really useful. And this came in earlier as well from James Mortimer of Hale, Michigan, right? So what are some communications ideas for members of local government to do this work?
Yeah, and I actually saw that Susan mentioned something about communications in the chat box. So I'm glad that people are thinking in this way, and we definitely have some great resources on forming your voice and thinking about even who the right people in your coalition are to offer that communication to the rest of the community or to the rest of new coalition members might be. So I think I would point people right again to the Action Center. We have a step called Communicate. There's a resource in the Communicate section that I really love. It's thinking about using the power of storytelling as a communication tool. This can take you step by step by thinking about how you form your message, who's going to offer that message, how you assess and think about changing that message. And so people can practice and really think about not just who they're speaking to, but how they're going to say it and what they want to say.
That's great, Joe. I think that's really helpful to think about. I know our 2793 message building tool is another really popular one that folks have used to really think about how to craft messages that really reach the appeal of who you're talking to, right? Not just what you're trying to put out there as your own message. So just another one to lift up. Maybe you want to turn to either Joe or Erica if there's anything coming in live right now that looks like something we could jump on.
I think we might offer the question. There was a couple that I wanted to maybe get to in the Q&A box. Alberto was asking, and Justin, you might be able to actually pick up this question a little bit. He was wanting to think about examples of how small funders are using county health rankings to inform grant-making strategies. They kind of want to hear the story of people who are kind of like them. So maybe you could remind us where we might hear some information like that.
Yeah, I think that's a really good question. I'll go back to that example I lifted up of LaPorte, Indiana earlier in the presentation of thinking about how from a foundation setting and in grant making using what works for health and evidence-based strategies to look at what they want to focus on. And specifically, if you're looking, maybe you want to address health equity in your grant making, right? So you could use the data in the snapshots and look at some of those measures that are disaggregated or broken down and looking at how those gaps exist by both place and race. And then looking at the strategies that really are likely to close disparities and how to kind of lift those up as well. I think those are some good approaches to take.
Yeah, and I would offer, just a few minutes ago, we talked about looking at our webinars that have been offered in the past to look at some of the community highlights from the RWJF Culture of Health Prize. These are all great places where you can see the ways that some communities have put these practices into action. Let me grab one more question over here. Charla asked a question. Charla, I hope I'm pronouncing your name correctly. And she was really embracing the idea of using evidence, which I know we all are. So perhaps Jessie can help me think through this. She was thinking that you know, the results of peer-reviewed literature, scholarly journal, experiments might be controlled. They might take a long time to get to the real world. How do we continue to think about our evidence-based strategies and making sure that they're up to date and relevant to communities in real time?
Oh, this is a really great question, and talking about evidence is music to my ears, so thank you for it. We make use of, as I said before, our highest level of evidence is systematic reviews and clinically controlled trials, but we also will look at quasi-experimental studies, descriptive studies, case studies, and local examples. We also, for strategies that are more emerging and there's good thought behind them and there's theory, but there hasn't been really much research done about the actual practice of them, we're still able to research those and acknowledge them with our evidence ratings of expert opinion and insufficient evidence in particular. We will be making use of less rigorous evidence, but it's still showing that it's a promising area. It's worth trying because then no matter what, you're building the evidence base. I would highly recommend that you go to the What Works for Health landing page, scroll down about halfway, and there you're going to see boxes about our methods and our ratings. And there it goes into much more detail about the sources that we use. We also, regarding root causes of inequity, we factor that into our disparities ratings, and we try and make use of the background on that as much as we possibly can. A lot of it just depends on what is available for us to build on and what is just theory. So keep building the evidence base for us.
That's great, Jessie. And we're going to be sending you direct links to the What Works for Health section of the website. And there's a really handy one-page guide that helps you think about how to use the resource. So those will be resources you receive after the webinar.
Great, guys. Thank you both for helping get through the Q&A there. There's a lot of good stuff and all those questions. I know we couldn't get to everything, but I'm going to try and bring us home here since we're closing in on time. So just lastly, I want to lift up, coming up in May here, we have a housing webinar that I think is going to be really great. We encourage participants to register for this upcoming learning opportunity, and it's on housing affordability and health and looking at community development solutions. And we're partnering on this, co-hosting it with NeighborWorks America, and we're going to bring back our lovely guest, co-host Sarah Norman, who's going to lift up Chelsea as a community, and they're also a Culture of Health Prize winner. So you can visit our website webinar section to register for that and also look at past webinars. And just lastly, I want to remind folks to stay connected. We are present on all the memes, right? The Facebook, you can follow us on Twitter and just connect with us via the e-newsletter if you haven't. And very lastly here, to wrap up and end out on time, I want Erica to chat out a link to a feedback survey. And if you could please click that link and just as a really quick survey we greatly appreciate you completing it and hearing your voice about ensuring that these webinars continue to kind of evolve and develop to best meet your needs, really, and that's the most important part. So your input's greatly appreciated and very useful. So remember just to stay in communication with us, use the contact us form on our website, and just a big thank you to everyone who participated with your comments and chats and questions, and to my great co-presenters as well. So thank you very much. Have a lovely afternoon, and we will connect with all of you guys very soon.